and is worse in smokers.
Yeah.
So
your technique is very good. I might tell you that.
Thank you so much.
So I'm going to stop share. Oh, I don't know whether, here, sorry. I'm going to stop sharing the screen. So if there is any question, please do the questions on the chat or the Q&A, so either Dr. Ali or Dr. Suntur can answer, while I'm going to upload the before-after pictures of those two patients, because it will take some time because of the software.
Okay, so we have questions.
Yes, what is the incidence of Tyndall effect with superficial subcutaneous relatively high G prime?
Okay, so that's a question of Ms. Dr. El Mohandes. That's a very good question, because we have the Tyndall effect can mostly, in my experience, happen when you use Restylane, when you get the blue effect. And when you're doing, it is important that you say that if you have a patient with very thin skin, is my opinion, to stay retroorbicularis, because you then can get a Tyndall effect. And as we showed, if we're enhancing the medial cheek fat, you're already deep. In those patients, you probably usually don't have to do the tear trough itself. If you have to do the tear trough, just go under the orbicularis, where the chance of having a Tyndall effect is lower, and don't use Restylane, because it gives a blue haze. With higher bell lips, I use most of the time, to be honest, in those areas basic, because it stays longer. I haven't had that problem. I don't know, Ersin, did you have this problem?
Well, when I started to use higher products, especially basic and lips, I prefer for tear troughs. I don't use, out of these two products, the other range. And I never had any Tyndall effect. But before, I agree with you. When I injected Restylane, even some Juvedem products, in the past, I had a few cases with Tyndall effect. My advice is to stay on the bone deep when you inject the tear trough, when you treat the tear trough. But it's not enough to treat the tear trough only. You should give some support to other parts of the eye, and because of that reason, I really liked and loved your way. Good, you did good. Thanks.
Thank you. Thank you. I learned from you.
There is another. There is another question from Justine Andrea Molina. Do you massage after injection at tear through? And I think they go together maybe. What happens if the patient feel hardness on their eye after filler?
Well, I haven't encountered that so often, but I think you just have to be very very careful not to inject too much. You can push a little bit of product into the right position and leave gently the gauze there with the higher bell post cream. It's not a good idea to really roughly put it into place. If you have put it there and you gently show where it is to be is okay, but no vigorous massaging is needed. Sometimes with you can do that here in the chin, and we know when we do that with this area, I sometimes do that together also with the cream when I use either Hybel Ultra to make really, really nice result. And in the males, we can use also subdermal, which gives really good result. But in the tear trough area, I tend to be a little bit more careful and not to do vigorous massage, because once they have a big hematoma there, they're going to look like raccoons for a long time, and they're not going to thank you.
So, can you combine HA fillers with fats?
Fat is one of the most ideal fillers that you can use, but it does not have a high G prime. So in this area, you can use I say when you lose bone, you need a gummy bear, like chewing gum. That's the high G prime filler. You can combine it with fat before or after. But when you do fat, it's like you say you're using fat, you're filling up your swimming pool. The top layer, which also evaporates with the sun, you can put some nice filler on top of that. So to have the double technique, the double improvement of both, and also fine tune your fat grafts together with a bit of fat. And I think that the HYBA range does really well with fat. I don't, for example, think that CAHA works well with fat, gives a lot of cysts, but I don't do it at the same time. So when I'm doing a fat grafting, I let the patient heal, let the fat vascularize. All the fat that has stayed is vascularized after 2 months is then vascularized there. Then you can think of topping up or improving the area with HA.
So I'm going to share the first patient on my screen with the first one we did here. So I hope everybody can see the before and after.
Okay.
This is before and just after.
And did you use Photoshop?
Quantifier, they always, no, I'm sorry. No, it's Quantifier. This is why I like this kind of, not only Quantifier, but there are 2 other software that are really, really, really good, and you cannot really
so you can see that we are here. You can see here that there's been an improvement from this area that improves, and it's not, and I want to draw your attention so that the V has been closed, is a circle, but it's not perfect, you see? So the 2 explanations I will give to the patient that say it's not perfect because 1, I am not God, I am only his assistant, and 2, perfection is not nice because then you are a robot. You have to be human.
But then when we
so it's improvement. Improvement is what we need, a softening of the lines. If you want to go and chase this bit and chase the other bit, then you can get disappointed.
But for example, from this software, I like this more than all the other views because on the clay you can see really the volume here, and how how you said how do you work on the swimming pool, on the top of the swimming pool?
Yeah. But we have to say something, to be honest, Felipe, we have cheated a little bit because we also treated the nasolabial fold.
With her. That was with her.
Yes, with her. With her we did it, right?
Not with her, with her.
Ah, okay. So with one we did it, the nasolabial fold, which is not the topic of this, but I felt that we had to do both the cheek and the nasolabial fold to give a good uplift, and then we can improve the circle. Was it with this patient or with the next one?
No, with this patient, because see the entry points?
Exactly. So I think we always have to be honest about our treatments. Some people say, oh, I only used 1 syringe or 2 and they use 10, And the other thing is you go to these conferences and some doctors say they show the fantastic results, but they use 20 syringes. Now who can pay for this?
I know a doctor in Philippines who has the clients who paid.
Okay, if you have these patients, send them to me. I'll give you half.
Oh, you can talk with him.
I treat the patient, I pay you half, but I don't have these patients.
Oh, he's a good guy. You will know him. You will meet him. It's really amazing. Maybe Dr. Osuntuk or
it's like finding in the plastic surgery, we call this a unicorn. It's like a very beautiful patient, very slim with very big breasts pointing forward. These are unicorns. If you catch them, keep them.
No,
don't let them go.
You have to see him. I will show you. I hope one day to be able to do a webinar with him because it's amazing what he does and what he showed us in Manila, last ISDS in Manila.
But I think Dr. Osuntuk will agree with me also that most of the patients that we have cannot pay for 20 syringes. It's true, or is in Istanbul they do it?
Yeah.
Most of the time, they don't pay for 20 syringe, no?
He's lucky, but I have to say he has an amazing technique, and the results are wow. And let's see, one day we can arrange a webinar with him together, all of us together, because what he does is amazing. So
okay, any other questions?
If there are any questions, face lifting. Okay, there is one question. Face lifting using ultra or subdermal?
Both. You can use both.
Yep.
Subdermal will give more swelling, but will give longer, consistent results. It's a bit rougher. So in women, I would use ultra, and in men, I would use subdermal, but that's very general.
Yep. But if you, I don't know from which country Dr. Karim Noor is, but if you need really a lot of lifting, go with subdermal. It's but inject less quantity. So if you inject, for example, 1 ml of the others with subdermal, try to inject 0.5, 0.6, and wait and see the result. And if the patient needs a little bit more, then you can just inject a little bit more, because subdermal is really high viscoelastic. There is one question, but I think we already answered this. What is the advantage of Hyabel for tear-through area compared to other fillers? How long does Hyabel last for that area? I think you already answered. Ali?
Sorry, Hyabel, exactly like I answered, anywhere from, depending on the patient's intrinsic characteristics, anywhere from 6 to 16 months, I would say.
I think this is all. If there are no more other questions, I think we have 20 minutes of delay. Sorry for that. If there are some questions that you want to have, okay, which type of Hyabel using nose? We are going to make a webinar for nose.
Yes.
We are going to do it, and we are going to do it nose. The webinar is going to be nose on Caucasian type and nose on Asian type. So we are preparing this, and you will be all informed about this. I don't want to answer this because I don't want to kill the webinar before we do the webinar. But we are going to make this. Can we have the email of both doctors and their WhatsApp?